Hello everyone, I'm Dr. Iza and today we are conducting a free webinar on how to prepare for MRCOG Part 2 exam. This is an essential guidance to ace your MRCOG Part 2 exam in first attempt, including the course material and how to tackle EMQs and SBAs. The target audience for our webinar is MRCOG Part 2 candidates, MRCPI candidates, FCPS and MCPS candidates, Saudi board and Arab board candidates. Let me now introduce you to our very proficient mentor, Dr. Yasmeen Haseeb, who's a professor and consultant obstetrician and gynecologist with 30 years of experience in the field. She has MRCOG from UK, FSCOG from USA. She's also a certified healthcare provider in medical education by a well-renowned Dundee University, UK. During her MBBS, she was also honored with President Gold Medalist Award for being the best graduate of the university. In addition to her 30 years of clinical and teaching experience, she is currently the MRCPI Examiner Ireland, MRCOG OSCE Course Faculty Examiner at RCOG UK. She's also the elected committee member of RCOG UK for Gulf. She has extensive experience as postgraduate resident training program director for MRCOG, MRCPI, Saudi and Arab board candidates. Well, I hope you will enjoy the session today. Your questions are all welcomed and kindly post your questions in the chat box. And we would also love if you could write your feedback about the session today, which is very, very valuable for us. Over to you, Dr. Yasmeen.
Good evening, everyone. And thank you so much, Iza, for such a kind and nice introduction. And I welcome you all to our today's session, which is specifically about the MRCOG Part 2. Actually, I have been not only actively involved in the clinical practice, but I have already been involved in the medical education, which is my passion as well. I have been working throughout my life for the Safe Motherhood Initiative, and at the same time, I have been working as the educator. So medical education, I love to work for, and out of which I love to work for all my colleagues and my junior colleagues to help them to excel in their life. And throughout my career and being involved in so many exams as an examiner, as well as course faculty member, specifically in the European exams, I felt that a lot of the people, specifically the overseas candidates, they are struggling hard to get through. And many a times they go through the failure with very minute percentage. And that's why the people, a lot of the time, they were asking me to conduct the webinars as well as the sessions. I was trying to do it at whatever the place and the time. But now, with a lot of the pressure from my junior colleagues and the candidates, I really wanted to help you all. So we are starting our courses, which will be including a few sessions about the clinical governance, which is a main part for the failure of the people who are coming from the overseas. And specifically, I have been involved in so many OSCE exams. So I have seen that the appraisal, teaching methodologies, and governance, as well as the research, OSCE stations are the one where the people are really struggling with. So today's session is actually about how to prepare for the MRCOG Part 2. And in our upcoming courses, we will be having a very comprehensive course on the clinical governance. And you people will soon get the advertisement about that. And I would say that the people who are really struggling with the clinical governance, they should also try to attend that one. So without any delay, let's move on to our today's session, which is about how to prepare MRCOG Part 2. So let's start with our session. So this is about the RoyalDocline. So next we move, this is about me. And Iza has very well told about me, about how is my career. So the people who have passed their Part 1 exam, immediately what they need to do. They should scroll through that how to apply for the MRCOG Part 2 exam. This is the most important part. And I have been asked many times that how much time is required. Actually, the people who have lot of the commitments, the home, the family, their jobs, it depends upon how much busy you are. But for the time being, I would say that 6 months is okay. If you at least study 8 hours a day, at least 6 hours a day, they can pass through this exam within about 6 month preparation. So let's see what is the eligibility. This has all been given on the RCOG website. The eligibility. In order to be eligible to sit the MRCOG Part 2 exam, the candidates must first have sat and passed MRCOG Part 1, as you all know. Candidates must also certify the eligibility requirement, which is regarding the currency and attempts, which are stipulated in the exam regulations. So you should be very well familiarized with the exam regulations. Then comes the expression of interest. This is a new thing which the RCOG has published on its website. This is because lots of the people, they are appearing in the Part 2 and Part 3 exam. So now the college wants the expression of interest, then, which means that when you are going to book your exam and what is your intention, when you want to book, for an opportunity to book into available spaces on the next MRCOG Part 2 exam. To do this, you have to submit an expression of interest form within this specified deadline. What is it? We will just see in a while. A candidate must submit a new expression of interest form ahead of each exam, stating they would like an opportunity to book a place. It means that every time you are sitting an exam, a new form has to be submitted. Your previous form will be finished with the previous exam. This is a very important point you have to know about. Then comes the expression of interest form. This is the form which I have downloaded from the RCOG website. And here you all know college has given you your account number, your specific RCOG number, which will be with you when you will get your degree as well. It will be over there. And with every correspondence, you will have this, a unique account number with the college. Then your email address. Please be careful. You have to submit the email address where the RCOG will be corresponding with you. So be careful that you have to keep watch of your email, which you have given to them. Then your first name, then your surname. And this is, I confirm that I would an opportunity to book a place on the next MRCOG Part 2 exam. You have to tick this box. So these are the MRCOG Part 2 exam important dates. Every exam, you know, they have the important dates which are to be announced on the website, in which the expression of interest, for example, the January 2025 will be Friday 20th September 2024. Then the booking window will open 29th October. Booking window will close on Tuesday 17th December. An exam will happen on 22nd January 2025. And ultimately, you will get your results on the 19th February. Usually, it takes about 1 month for the college to publish the results of the exam. Now, this is the MRCOG Part 2 fee. You have to look into it, and according to your banding, you have to submit that fee. These are band A, B, and C, and those people who are working in the UK and Ireland, they have the different amount of the fee. So I have taken just from the RCOG website. The question. There are few questions which are called as a frequently asked questions. You can just click on it and you can read about them. Maybe there is something in your mind which would you like to have the answer, or if at all you have some answer, the college is very helpful in this regard. They have given their email address, as well as you can even call them on the given number. This is all given on the RCOG website. Then comes an important question, that how many times a candidate can attempt the MRCOG Part 2 exam. They have said that the candidates who are based in the UK and they are trained over there and they intend to enter the specialist register in the UK, they are permitted not more than 6 attempts at the MRCOG Part 2. Candidates who wish to apply for the MRCOG Part 2 following 6 previous failed attempts, they have to provide a supporting documentation from their head of school or equivalent outlining the exceptional reasons for permitting a further attempt at the exam. So this is important to note down. And if you still have any query, you can always write to the exam and then through the email, and they can answer you back about your situation. Now, the format of the exam. This is very important to know about. Previously, the exam was paper-based. Now, it has been shifted to the computer-based testing exam. Candidate must pass the MRCOG Part 2 before taking the MRCOG Part 3. There are 2 computer-based papers, and each paper counts for the same amount of the marks. It has got the 2 papers, paper 1 as well as the paper 2. Paper 1 counts for 50% of the marks, and the paper 2 counts for 50% of the mark. And each paper consists of 2 question formats. Like in one paper, you will have the single best answers, which will count for about 40% of the total marks. And extended matching questions or EMQs, they worth about 60% of the total marks. So these 2 will appear in the paper 1, and these 2 will also appear in paper 2. So this is how the exam happens. Timetable. The paper 1 duration is 3 hours, which is 180 minutes, and the number of the questions will be 50 SPAs and 50 EMQs. Time management depends upon your own self. That is, this is your own way to manage. However, the RCOG recommends that you should spend 70 minutes on the SPAs and 110 minutes on the EMQ questions. Then there will be a lunch break, about 60 minutes, and the paper 2 will also have the same thing. So you are the one to manage your exam and the time. Let's go through the errors by the candidates, why they are not attempting the paper properly. And these are, number 1, they are not reading the candidate instructions clearly, specifically in the extended matching questions. This is very important. You are just missing one part or one point, and from there, the whole point of exam is gone. Secondly, you will see that people are not making sure that they understand the question. You should understand the question. Then there is a lack of application of the relevant knowledge, as I have made it bold. Relevant knowledge. This is very important. Then they do not concentrate on the buzzwords or the keywords. They have to concentrate on those words, that what the question is asking from the candidates. You have to have a lot of the practice to get these buzzwords and to know about these keywords. That's why these are the common mistakes and the common errors which the candidates are making. Now comes how to prepare, what to read, smart targeted preparation. Everybody is studying. Of course, this is a big exam and everybody is studying hard. Of course, you are going to have a globally recognized qualification, and everyone is studying hard. But what to study and how to study? This is the question. That's why I'm here. You have to study smart along with the studying hard. Not only studying hard, you have to be very smart, not only in your preparation, but in the selection of your syllabus. Please remember, all the syllabus has been mentioned very clearly on the RCOG website. Please go through the RCOG website. You will get everything from there. Second is the selection of the sources, time management, practice, practice, and practice. Specifically, I would say that EMQs. EMQs are the killing part of this exam, and EMQs are actually designed to have a real knowledge in depth of the candidate, because this is an exit exam and the college wants to see you as a safe doctor and up-to-date doctor. Revision, no half-hearted attempt, please. My many junior colleagues who are also here during this webinar as well, many of them, they are coming to me and they are asking me, we are going to exam, and are you conducting some course, and can we go through that, and this much time is left behind. I told them, please do not go for any half-hearted attempt. Why? Because it will just create a stress in you and nothing else will happen. So you should have a proper full-hearted attempt for the exam. Syllabus. What is the syllabus? Syllabus is actually the RCOG recommended sources only. Please note down the words I have written, RCOG recommended sources. And RCOG recommends green top guidelines, which are the backbone of the MRCOG Part 2 exam. And these are all available on the RCOG website. You can download them. There is an app as well. You can go through them and you can read them as much time as you want. And secondly, you can highlight them. You can make your own questions from them. And at the same time, there are new things which are being added by the RCOG committee in the Green Top guideline is they are adding the summaries in it, which are very beautifully written in all the upcoming new guidelines. You will see that they are adding the summary in the beginning of each guideline, which is the best thing. And I like it too much. Of course, it takes a lot of the effort and time. And that's why I would say that this is one of the very nice and supportive hand by the RCOG for the candidates. Then comes the NICE guidelines. And you have to go through the NICE guideline as well. Then comes a Faculty of Sexual and Reproductive Health guideline. You all know that this is about the contraception and a lot of the things are given over there, even at the end of the guideline. You can see there are many single best answer questions over there and multiple choice questions are over there. You have to practice those as well. Then comes the DASH guidelines. And also, please, those people who are thinking they should not go through the strategy, please do not make this mistake. Strategy is a very beautifully written and very comprehensive source for you to go through. This is the college itself source for the study, and it has been written with great effort. Lot of the people, they are writing it and it is being updated every now and then. So you have to go through them. And specifically in my last webinar as well, the people who are studying for the MRCOG Part 3 exam, they have to go through the case studies as well. These are the beautiful source for the OSCE stations as well. And there are a lot of the EMQs as well as single best answers which are given at the end of each core module. So those people who have not subscribed to it, I would strongly recommend they should buy it and they should subscribe it if you really want to pass the exam. Myself, when I was preparing for the exam, I was too much afraid of this strategy. But now, with the passage of the time, when I subscribe to it, and I'm still subscribed to it, because as a member, now I have been given a free access to strategy. I really love to read it and to go through it. This is the best ever source, which I would say that. Then comes the college itself, EMQs and single best answers. And they are also available in the strategy, and you can buy them with a very little amount. And access is there for a longer period of the time. You can go through them. You can see that how the college thinks about the EMQs and how they are putting the questions. You can get an idea. So everybody should buy and practice them. Then comes the TOG articles. TOG also play a great role, and there are few TOG articles which are very, very important. Although the different people, they are telling you that read about last 5 years TOG. You are not supposed to read all the TOGs. For the TOG selection, you should be very wise and very smart. We will see that what are the important TOG articles which you should read about. Then comes the NICE guideline. I have taken the outline that what are the important topics which you are supposed to do by heart from the NICE guideline. This is the perinatal mental health. And a full-fledged OSCE station also comes from the perinatal mental health. So about the medications, their side effects, their college makes the few case scenarios, and they put them as the EMQs. So you have to go through it very, very nicely. Diabetes in pregnancy, hypertension in the pregnancy, intrapartum care, CTG questions, very important. You can get even the trace of the CTG, and they can make a lot of the EMQ questions from that CTG part. postnatal, then the cesarean section guideline, induction of labor, preterm labor, urinary incontinence, infertility, and the LARC, which are long-acting reversible contraception. So these are the important, nice guidelines which everybody should read. If you want to read the other things from the nice guideline, it's okay, but these are the guidelines which you have to go through by heart. Then come FSRH. Here, you should know about the UKMEC, which is the medical eligibility criteria. This is the first thing. You have to go through them. Then POP, the progesterone-only pills. Then comes oral contraceptive pills, implants, injectables, contraception after 40 years of the age, and the postpartum contraception. All of these guidelines are very important, and the few questions which are given in the end of each guideline are also very important to practice. Here comes the TOG articles. I would say that you should, after doing all the guidelines, you should go through the TOG articles, and many TOG articles you will also do with the topics. For example, we will see that how are they, but at least you should read the last 3 years TOG articles. Or if something very important in the last 10 years or even 15 years that is important, you can go through that. So let's see, for example, the infertility. You have to do the assessment of the infertility. This is a beautifully written assessment TOG article. Then comes the surrogacy, ovarian hyperstimulation syndrome, hyperprolactinemia. These are the important TOG articles related with the infertility. Similarly, in the surgical core modules, there are the abdominal wall incisions, uterine perforation, enhanced recovery program, nerve injuries, abdominal cerclage. These are the important things which are in the surgical module. Then comes an oncology. College loves the borderline ovarian tumors. It comes in your OSCE, it comes in your exam, it comes everywhere. So please go through the borderline ovarian tumors through, from the TOG. Fertility sparing surgeries, as well as the BRCA genes. So these are the important articles for the oncology point of view. In the menopause, HRT, which is a hormone replacement therapy, alternatives to the HRT, and the medical disorders in the pregnancy, headache, very important, very nicely written TOG article. Spinal cord injuries are very important, ischemic heart disease in the pregnancy, skin eruptions in the pregnancy, which are the skin disorders and how they are being managed. Postpartum urinary retention is important. Appendicitis in the pregnancy, systemic lupus erythematosus or SLE, cystic fibrosis is nicely written, asthma, liver disease, bariatric surgery, pregnancy after the bariatric surgery, polyhydramnios. So you can find many things in the TOG article. Rather than going here and there, you should try to find it out in the TOG articles. Additionally, you have to go through the scientific impact papers, the consent issues, as well as the clinical governance part. The clinical governance is a very important topic. You cannot pass this exam without going through the clinical governance. Everybody should be aware about the clinical governance and taking into account, and on the lot of the pressure by my junior colleagues, I'm going to have one workshop on the clinical governance. It is almost ready, and soon you will get the data about it. So I would encourage all the candidates who are attending today and your friends, and specifically those who are appearing from the overseas, they should attend this workshop to know about the clinical governance. This is there all of the time in your MRCOG Part 2, in your MRCOG Part 3 exam. So you have to be fully aware about the clinical governance part. This is a full topic, and in the modules of the MRCOG Part 2 as well as MRCOG Part 3. Then comes the Embrace UK, which is actually the confidential inquiries about the maternal deaths and about the maternal morbidities and the mortalities. And now the new name is Embrace, in short, which is Mother and Baby Risk Reducing Annual Confidential Inquiries. This is the new name, which has been given about 3-4 years ago. The CMAC was the past name. but now they have changed the name to Embrace, and it is published every 3 yearly, and you have to know about the last 3 years, specifically the most recent one. What is the leading cause of the maternal mortality, and what are the recommendations? You should go through the summary, you should go through the pictures, and try to read about the recommendations, try to read about the recent trends in the Embrace. This is very important. Then keep watch on the RCOG website about anything, any new thing, any news, any publication, anything which is upcoming. Off and on, you have to go through the RCOG website once or twice in a week to see if there is anything new coming. For example, some new guideline may be archived and a new guideline will be coming. Any new thing which the college is trying to tell you, you have to keep watch on the RCOG website. Now, the next question, which the people are asking me, what are the books? I told you the syllabus, which you have to do. And then comes the books for the EMQs as well as the books for the SPAs. These are the important EMQ books. You can see that I have put their pictures, and now we will also see their names as well. So these are the important single best answers, out of which the Amanda Jones is by the RCOG itself. This is a must read. And then comes the book's name. In the EMQs, Prabha Sinha, Tahir Mahmood, Kelwani, Andrea Pillington, Janesh Gupta, EMQ part, Rekha Buntakal. And then comes the single best answers, Amanda Jones, Seema Sharma, Brian McGowan, Janesh Gupta. Succeeding the single best answers, Andrew Caesar. Andrew Caesar has done a beautiful job, and he has written a beautiful books in the single best answers. You will really enjoy this book. And along with it, you have to go through the TOG articles. TOG articles, every time they publish the single best answers in the end of the, which are sort of the MCQs. In the end of each topic, the TOG article has got the question answer part. So you have to go through those as well. And as I said, the RCOG, in the RCOG, the strategy, you can get that. Now we will see that the people who are thinking that they will just go through the recalls of the last 3 years, 5 years, and they will pass the exam. I would like to highlight, please correct yourself, and you should come out of this misconception. There is no shortcut for this exam. Please, there is no shortcut for passing through this exam. Doing the recalls, number one, the recalls are written by the people who attend the exam, and this is by the human being. We forget when we come out of the hall, almost like 50 to 60% is gone. Only 30 to 40% is the one we retain as a human capacity. So whatever they are writing, coming back home, and they are writing, this is not 100%, number one. And number two, you cannot rely only on the recalls. Yes, it can happen. The college can repeat 1 or 2 questions, sometimes 4 or 5 questions. But at the end, every time, there is a pool of the question, and the question committee always update the questions. So kindly be careful, and you should not rely only on the recalls. Recalls you can do just to have an idea that how the college committee is writing the exam. So if you think that doing the recalls only gives you an idea about the questions only, and it is not giving you anything else, it depending upon the recalls, it is not the way to pass, and it needs a comprehensive preparation, as I said. So please, the people who are relying upon the recalls, come out of it and start preparing yourself for the real exam. Tips. Tips are, before you attempting any question, you have to see what the question is, from where it is coming, and what it is asking me. And also, you should practice that how you can catch the buzzwords, keywords in the questions. This is very important part. Secondly, learn the techniques to attempt How it will be done? By practicing. Every day you have to practice. Every day you have to put your path for passing the exam. So the people who are really very serious to get this degree, they should come ahead and then they should read and do the techniques and everything which I'm telling you. Otherwise, there is no shortcut to pass the exam. And revise, 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 and then revise very wisely. I put the dash in between re and wise, means that you have to revisit and revise it wisely. Not only reading the guideline and just thinking, oh, yes, I have revised the guideline, and that's it. No, you have to revise it very wisely. So what we do at RoyalDocline, we advise how to read the guidelines smartly, because the people don't know exactly how to read the guideline. In my rounds, most of the time, my residents who are here, they know that I always tell them that how to read the guidelines smartly. There is a way to read the guideline. This is not just to open up the pages and you, okay, A, B, C, D, and then in the Z. No, you have to see how this guideline has been written. What are the sources? What are the areas of the recommendations? What are the important parts? There is a way to read the guideline and way to read the guidelines smartly. This is what we will teach you. There are new traditional methodologies which will be applied for teaching the people, and as being involved actively in the teaching, and I have been certified from the Dundee University of the medical education. So I myself learned a lot of the methodologies to teach the people. So there is no more traditional methods. And other thing, I don't want to do or give the summaries to my people, because the guidelines, they already have the summaries. And please remember, the people who are in a habit to read only the summaries, they are making their own summaries and they are revising through those summaries. This is not the best way to pass. This is not the best way to pass. Please mark your guideline and you have to read directly from the guideline each time you are reading. If you want to make a note, make it on the side, or you can put some short papers over there, small papers over there. You should not make a separate paper for the summary. Guideline cannot be summarized, I tell you. So you have to read the guideline directly. The people who are saying, we give you the summaries, we give you this, we give you that, I don't believe on this. Then comes the 5-minute guideline series. The 5-minute guideline series by the RoyalDocline is done by me directly. This idea has been given to me by my son, who told me that why not you help the people by giving the 5-minute guideline series just to revise it beforehand before they go to the guideline itself, so that they know that how the guideline is and what are the important points. So this idea touched my heart and I started working on it. So on day-to-day basis, I am adding more and more guidelines to it, and the people are really liking it. And I'm planning to do the oncology as well in the same way, because through the 5-minute guideline series, if you will go through it, you can see that I have given you an idea within about 5 to 6 minutes what exactly the guideline is, what are the important recommendations, and what is the summary points which are important from the exam point of view. So if the people who are watching this one, this is available on the YouTube, and we will share the link to everybody who is interested. And if you go through these 5-minute guideline series, you can get an idea before you go to the original guideline. And when you go to the original guideline, then you can read it very quickly and you can understand it. The idea is this: before reading the guideline, watch our 5-minute guideline series as many time as you want before reading the guideline, and then even after reading the guideline, and even a quick revision before the exam. So this is in that context. Then we will also form a WhatsApp as well as the Telegram group, where we will have the daily activities. And we are planning to have twice weekly online classes with me directly, rather than buying and learning by yourself with application of new methodology in the teaching. I don't like the people to who are so busy to have an some system and then you revise by yourself. I love to teach by myself. So this is my way of teaching, that I want to teach as myself and directly, so that the people can get what they want and they can ask the question there and then. As we are so busy, we cannot go through the LMS systems. That is, you just keep it on and you are walking and talking and you are listening. No, I don't believe on those systems. So my way is to have the direct online classes with my candidates and with my students. So RoyalDocline MRCOG Part 2 extensive course for the January 2025 will be starting soon, and aim of the course is to help you pass through the MRCOG exam. And the course synopsis is, the course will be 30 sessions, 6 hours each, making about 180 hours plus. And in each, we will be discussing all the important topics of the studying, transformative information integration solution, which will include the Green Top Guideline, NICE Guideline, FSRH Guideline, BASH Guidelines, and the TOG articles. So these are the important things which will be discussed. And here we end up with our session, and now I will request Dr. Azza to kindly go through the Q&A session so that we can answer the queries and the questions. Yes, Dr. Iza, I'm here to answer.
Okay, great. Dr. Yasmeen, the first question is by Noor, and she is asking, can you share any success stories or strategies from past candidates who have performed well?
Yeah, we have actually, I have guided them personally. There are few stories specifically. One was my friend. I will just make it as an anonymized, because she was very sad. She was very upset. She attempted the exam 4 times. She was actually attempting the exam with me. And then I succeeded, but she could not succeed. So then I helped her by my way, by taking her classes and just giving her support. And she was very upset. And ultimately, she passed the exam. So I'm so happy when she passed the exam. Similarly, many more examples are there who passed the exam with our guidance and support. Actually, the people fail, Noor, because they don't have the proper strategy for the exam. This is the basic thing. And as I said, that why the candidates fail, they do not make a proper strategy. They do not study smartly. They do not know how to read the guidelines. They do not know what are the sources for the syllabus and what are the sources to study. They just make the summaries. Many people, they are in a habit to make the summaries. Please just make in your mind, this is not a traditional exam. This is something which is giving you a global, sort of the degree. And this exam assess you just as an extracting a lemon. That is, they want you to be assessed from all points. So that's why they want to assess you from each and every aspect. That's why you have to be very smart in your preparation.
Okay, great. Okay, so the next question was, what are the most common mistakes that candidates you see making during the MRCOG Part 2 exam process?
Yes, as I said that, number one, they do not select the proper syllabus, source, guidance, and they don't know from where to study. Then there is a time limitation. They do not prepare properly. And then there is a way that they have the half-hearted attempts. They are not prepared and they are thinking, we will go and see how the exam is. This is not a good approach. I would say that you should think about first, you want to do this exam or you don't want to do this exam. If you want to do this exam, then you have to be very serious. You have to find out the ways where I have to go. You have to navigate your path rather than just thinking about yourself. Oh, I can do this. This is not an undergraduate exam, and you have to be very smart. Then people, they are also very stressful. This is another way. And the people, they start taking some sort of the anti anxiety medication, anxiolytics, and they are very stressed out on the exam. Please don't be stressed out. You can do it. People are doing it. This is not something which you cannot do. You can do it, but with the proper guidance, with the proper selection of time, proper selection of the resources, proper selection of the guidance. You can do it, and the practice. And then on the day of the exam, they are so much stressed out. They do not read the question properly, and they are hurriedly attempting the questions. So these are all the things which are the mistakes which the candidates are making.
Okay, so the next question is very related to the previous one.
Mhm.
Um, can you suggest some techniques to reduce anxiety and stress during the preparation period?
As I said that, as Dr. Isa said, I told you that you have to relax. First of all, talk to yourself. Should I do it or should I not do it? Because it will put your effort, your money, your time. If you are committed, you can do it. And you are your own boss. You are the one to control your anxiety. And you have to prepare properly. You have to prepare it nicely. And you have to have a study buddy and also have the group study. Then you will pass the exam. I hope so.
Great. So the next question is by Annalise, and she's asking, what should I focus on in the final weeks leading up to the MRCOG Part 2 exam?
This is a very good question. First of all, relax. First of all, relax. What you need to do, now you have done your best. You have prepared. For example, the 2 weeks are left. What you should do, you should practice. Every day, you should do the mock exam. You should do the mock exam. Set the alarm. This is what I was doing. Set the alarm and you have to do your exam. 50 single best answers I will do in this much time. And 50 EMQs I will do in this time. And then up till that time, you have to finish it by the alarm. And then you have to check your questions by yourself. And once, for example, any question is wrong, you have to go back and see your question's real answer. And then you should see that what is your mistake. This is how you will pass the exam. And at least 24 hours before the exam, stop studying everything. Don't try to digest everything one day before the exam. It will just create anxiety. You cannot do anything 24 hours before the exam. Just relax yourself, focus yourself, prepare yourself mentally that I am going for the exam and I will do it. Just believe on yourself.
Okay, great. Miss Fiza is asking, can you explain the marking scheme for the MRCOG Part 2 exam and how it impacts preparation?
Yeah, marking scheme is actually the college committee decides. There are a lot of the criterias which I cannot uh, just highlight right now because each exam, they have their different marking scheme depending upon the different criterias. So this is something which is very confidential.
Okay. The next question is, what is the best way to handle difficult or unfamiliar questions during the exam?
Yeah. First of all, college will not give you unfamiliarized things. Yes, the college can give you in a strange way. This is the way the college gives. What you need to do, for example, you are doing, let's say, you are doing your EMQ, because EMQ is the part where all of you are struggled. So let's see, the EMQ part is there, and this is a very tricky, strange question. So just make a star with a pencil or something that is you highlight it with something so that you remember it and do your rest of the paper. Then come back to this question and think about, give the time to this question. that what this question is and from where it is being asked. There is no weird sort of the question, although they can change the scenarios. This is what you have to do a lot of the practice. So in this way, you can tackle the things.
Okay, so the next question is about the situational judgment questions. And the question is, how can I practice effectively for these questions?
Situational judgment questions are actually related all with the clinical governance, related with confidentialities, related with the ethics, related with consent, related with the surprised situations. There, I would say that you have to have a core knowledge of the clinical governance and try to practice the questions. You will not be given something which is beyond your practice area. The people feel difficulty because they are unaware about this framework of the clinical governance, which happens during the situational issues, which creates the situational issues. And now all of the hospitals, they are everywhere. They are trying to uh, put the clinical governance in their real practice. And there is a quality improvement. There are ethics, there are confidentiality issues, so many things. So you have to have the grip on this subject. That's why we are also conducting the workshop on it very soon.
Okay, great. I hope you guys join our next workshop as well. So the next question is about the single best answers. Can you provide tips on how to approach the single best answer questions correctly, especially if there is confusion between the two options?
Yeah, it happens. College make the question in this way, and the single best answers are usually, I tell you, single best answers are easy as compared to the EMQs. So I would say that you should do the SBS first, then the EMQs, as the college says. The SBAs are usually related with the drugs, with their side effects, with their mode of actions, or with the antidotes. This is one way. Secondly, they can give you something like pathophysiology. Thirdly, they can give you some incidences. And the incidences you have to learn by heart. So these are the things, important things. And then sometimes they can give you some rates, some ratios, some research paper questions. So these are the questions where the single best answer fit. Yes, there are the questions where the two options are very close to each other. You should mark them with the pencil and just go through rest of the paper so that you do not waste your time only on one question, rather attempt rest of your question. Then come back, try to memorize again and again that what this question is. And if there is still any confusion, please select whatever is the best in your mind. So this is the best way. Do not leave any question empty. There is no negative marking. Okay, do not leave any question. Please mark every question. So sometimes the confusion happen, but whatever is coming best to your knowledge at that place, you should mark that.
Okay, so the next question is about the past paper and mock exams, how important they are for the preparation.
I would say that you should do the past papers as well as the mock exam, but you should not totally rely upon them. As I said in my one of the slide, that recalls past papers, they are not the only way to pass. You have to struggle hard, you have to know the subject by heart. Yes, you can practice them just to get an idea that how the exam is, how the college thinks. And the people who are coming back from the exam and they are writing back their recalls, they are not able to write it 100%. And maybe you will not be able to find even the correct answer for the paper for that particular question. So do not rely only solely on this part. You can practice them just to have an idea.
Okay, so guys, that means there is no shortcut. And the next question is, what advice do you have for staying motivated throughout the preparation of MRCOG Part 2?
Yeah, you have to be motivated throughout your preparation. My personal experience is You should have a study buddy, number one. Number two, not only one study buddy. You should study in a group of 3 to 4, not a bigger group, not a smaller group. If you go through, this will keep on having a dynamics of the group. Have a WhatsApp group with your friends, 3 to 4, and always put your queries over there, discuss with each other. If you differ, your opinions differ, go back to your guideline and then go through that and see the real answer. This is the one way. Secondly, you should always tell you that I can do it. You have to be motivated. You have to motivate yourself each and every day. You have to motivate yourself, and you have to motivate your group as well, that we can do it jointly. You have to help each other, share the things and share your work. For example, if you are doing the hypertension, you do the diabetes, so let's do like that. So this is the way. It keeps the dynamics in place, and you can enjoy the study, and you can also support each other, and it can also give you a hand that you can study and you can go ahead. This is the only way, I think.
Great. So Miss Fatma is asking, what resources do you recommend, especially for mastering the clinical management questions in the exam?
For mastering,
Yes.
Fatima, is really a big challenging term. I would say that read your guidelines, read your syllabus, number one. Number two, your clinical work. Your clinical work will not be replaced by anything, your clinical experience. Sometimes in the exam, the questions can be not only from the guideline, but from your clinical judgment. So your clinical practice, your training matters. This is number two. And number three, practicing from the different books. As I said, I have given you the names of those books. I have given you the talks. I have given you the SIPs, Embrace, and then a wise selection of the courses. So these are all the points which can help you mastering the exam. And also, as I said, somebody asked that how they can prepare in the end of the exam days. Do the mock exam by setting the alarm, and then check your paper by yourself honestly, and then check your wrong answers there and then. For example, you choose the wrong option for somebody in the contraception, then you should see that why I chose the wrong option, what I missed, and what is the right answer. You have to go back that guideline, and you have to see what the guideline says about it. So this is the way it will stick in your mind, and doing it again and again, it will stick into your mind.
All right. So that's also the answer for the time management as well for everybody else who's asking. I'm going to take the last question. And the last question is, how should I balance studying between theory and practice for MRCOG Part 2? How much time should I allot to each of them?
Actually, one time I would say that you should go through your theory in about 2 months or 2.5 months time. Then the next 2 months, you should practice theory as well as your exam. And then the rest of like 2 months, you have to do more mocks. And then in the mocks, whatever is wrong, go back and then read those parts. This is how you can tackle the exam.
All right. Thank you so much, Dr. Yasmeen. Thank you so much.
I would say that Iza, thank you very much for all your kindness, for all your help, for your time. Thank you so much, RoyalDocline team. I'm so grateful for handling and tackling such a wonderful webinar today. And thank you everybody who has attended. And I would encourage everybody to kindly just write down your feedback here so that it will help us in making more 5 minutes guideline series, as well as it will help us to modulate, and it will also help us to include the different things which you people want to know, because our aim is to help our candidate and to help you pass everybody. So please share your feedback. How was the session? And what important things you would like to do from my side, and what are the difficulties you people are facing. So I would love to answer all those things. And soon we will be having as I said, that clinical governance as well as MRCOG Part 2 exam courses, MRCOG Part 3 exam courses. It is in the way. We are working on it actively. So thank you, everyone. Stay blessed and good luck for your exam. And don't worry, we are there with you. And I tell you, believe on yourself. You can do it. If I can do it, you can also do it.
Okay, so everyone, the chat option and in-call messages option is open. Especially, we would love to have some kind of feedback from you guys. What did you like about this session? What did you think should be improved? And what other topics do you think we should cover? We would love your feedback. You can also email us, as we have told you, and you can also reach out to us directly on our WhatsApp as well. Okay. So I'm gonna wait for a bit. And thank you so much, Dr. Yasmeen. It was a very enlightening, very easy to understand, very fun session that you have done. And I can't wait for the next one, especially. And I hope everybody in the audience keeps their eyes on the prize, which is the ultimate success to clearing all these exams and, being successful
Of
at it.
course. Thank you, everybody. So we are waiting for your feedback for a while.
Okay, so far everything is all praises.
Thank you so much for your praises, for your support. Actually, I want everybody to see you as a growing consultant and becoming a big doctors, serving the humanity, saving the mothers. We should work collaboratively for Safe Motherhood Initiative.
Okay, so okay, great. So Ferreira is telling us that it was an excellent webinar. Thank you so much, Ferreira. Hania is telling us that the webinar was very informative, very helpful. Thank you so much, Hania. Please share any suggestions or any topics that you would like us to cover as well, give us tips, because we are going to cover, of course, all the important things and everything, but apart from MRCOG, if you want anything specific, let us know. Okay, don't hesitate to ask us at all, please.
Okay, thank you so much, Iza. Thank you so much, my RoyalDocline marketing team. And I cannot resist to say my hearty thanks to all my team members, Waleed, Shahryar, Izza, everybody, Jazib. Thank you so much. And my heartful thanks to you to make this webinar possible. And everybody who joined us today, from my candidates, from my junior colleagues, and the people who are going for the exam. I wish you good luck at each and every step. And I hope you will do it. Everybody can do it. Just believe on yourself. Just believe on success. It is very near to you. Good luck.
Okay, thank you so much, Dr.
Okay.
Yasmeen. Thank you so much.
Have a
Okay,
nice day
so
ahead. Hmm.
there are a couple of suggestions about the PLAB. Are we going to do the PLAB one?
No, I am not planning about the PLAB. I'm going to do for the MRCOG Part 2, Part 3, and Clinical Governance CTG courses. Actually, I am very busy practitioner as well.
Okay.
The people who are
Okay.
here, Fatma
Yeah.
Zumra, my very good candidate, and Zeenat, our other candidates, Shireen, they are all here. They know how busy we are. I work as a consultant in Bahrain and in the Salmania Medical Complex. I have been working in the Gulf for a longer period of the time, and they are also working with me. They know that how busy we are. So for the time being, we are just going to do the MRCOG Part 2, Part 3, Clinical Governance CTG courses. Maybe in the coming time, we will be doing the OET exam or the some PLAB courses as well.
Great. So, guys, please keep an eye out. We will see you soon, inshallah. And again, if you have any questions, anything else that you want to ask from Dr. Yasmeen, please email us or WhatsApp us. Just contact us, okay? Best of luck for all of your exams, and we'll see you on the other side, inshallah. Allah Hafiz, everybody.
Okay, goodbye. Have a nice day ahead. And I would say that believe on yourself. You will do it one day.
Thank you so much. Thank you so much, Dr. Yasmeen. We'll see you soon,
Goodbye.
inshallah. Goodbye.
Goodbye.